breast cancer, and this is the journey. Okay, so here we go. Today I will be defining what a survivorship is. I will be discussing the latest facts and figures, the cancer-related late and long-term effects, treatment for late and long-term effects, the screening for subsequent and new primary cancers, care for healthy living recommendations. So the survivorship definition is any person with a history of cancer from the time of diagnosis through the remainder of their life. That's why it's called the journey. So these are some facts and figures. In the United States, the top 4 states with the largest amount of survivors are Florida at 1.2, Texas at 1 point, almost 2 million, California at 1.7, and New York at 1.1.
Hi Marie, I'm so sorry to interrupt. Is there a way that you can speak up a little bit? We have some attendees that are unable to hear. Thank you.
No problem. Let me know if this is okay.
This is much better. Thank you.
You're welcome. Okay, so cancer survivors by site. So it is estimated in the United States as of January 1st, 2022, in female, breast is the number 1 site. And if you can see here at the bottom where it says of all sites, there are 9.7 million survivors. And of those, 4 million are breast cancer survivors. In males, it is prostate. And I will show you further along what other cancers. Okay, so the trend in the United States, as of 2022, there are 18 million survivors and growing. Of those 18 million, 50% of these survivors, number 1, are breast cancer survivors at 4 million, prostate at 3.5, and the third is colorectal cancer. Cancer-related late and long-term effects. So in breast cancer, which is what we're going to focus in, lymphedema is one of the signs that are long-term effects, and this is swelling that is caused by removal or damage to underarm lymph nodes. Number 2 is peripheral neuropathy, and this is the numbness or tingling. Chest wall, arms, and shoulder. We also see it in the fingers, hands, and arms. Sexual dysfunction and impaired fertility. Cognitive impairment. This is what they call chemo brain. Memory dysfunction and memory concentration issues. Anxiety and fatigue. So we have some treatments for lymphedema, okay? Wearing a pressure garment, which we also call that a sleeve to prevent fluid buildup, okay? Lightweight exercises to prevent worsening of the condition. Weight loss is encouraged because that minimizes lymphedema. There are medications to relieve swelling, such as diuretics and others. Laser therapy, surgery, bandaging, or massage therapy are treatments that are used for lymphedema. Peripheral neuropathy treatments. So there are non-steroidal anti-inflammatory drugs such as ibuprofen, and there's also antidepressants that are also used to treat and relieve the pain, such as venlafaxine or nortriptyline. There are some anti-seizure medications that are used to relieve pain, gabapentin and pregabalin. Self-care, we always talk to you, we always encourage before you start any type of exercise or program to always discuss it with your medical oncologist before starting. We always encourage exercise regularly because that promotes oxygenation to the tissues, which alleviates peripheral neuropathy. Quitting smoking is important because when you smoke, you constrict, so less oxygen to the tissues and worsening of the neuropathy. Eating healthy, especially low sugar, is beneficial because sugar affects nerves, so you want to eat a healthy diet low in sugar. In nutrition, we want you to eat a healthy, nutritious diet that includes a variety of fruits and vegetables, whole grains, low-fat dairy products, skinless poultry and fish, nuts, legumes, and non-tropical vegetable oils in the diet. Again, you want to reduce the intake of sugar because, like I mentioned before, sugar affects nerves. avoid excessive alcohol because that affects and makes your peripheral neuropathy worse. And you want to take care of your feet, especially if you're diabetic, because you want to make sure that the sensation can be altered, and you want to make sure a podiatrist is looking at your feet, checking the sensation, cutting your nails properly without any nicks or that can higher risk for infection. So that's why you want to take care of your feet. Third, sexual dysfunction and impaired fertility treatments. So this is a common and distressing side effect of treatments for female survivors. So first, we want to assess for medical issues that impact desire and responsiveness. These are your heart disease, arthritis, obesity, fatigue, mood changes due to disease and its treatments, changes in body image, diabetes, alcohol, drugs, pain meds, or other drugs. That could be the cause of the sexual dysfunction and impaired fertility. We want to assess for psychiatric or emotional problems. Depression is one of the most common causes of decreased libido and other sexual disorders in females. Anxiety is another common cause of sexual problems. There are also some medications that are used to treat for the treatment of depression that can affect sexual dysfunction. There are antipsychotic medications can affect, beta blockers that are used for blood pressure, antiestrogens, and aromatase inhibitors. And these are prescribed to females that are estrogen positive. That will be your anastrozole, tamoxifen, exemestane, or gonadotropin releasing hormone agonists and antagonists. And these are drugs that are used to treat endometriosis or fibroids. The treatment for sexual dysfunction is first managing stress, fatigue, and relationship issues. And these can be accomplished by exercise, yoga, massage, meditation, and other mind-body techniques. Sleep is super important for the treatment of sexual dysfunction. So you want to prioritize sleep, and trying to find other ways to reduce fatigue may also improve sexual interest. Working with a professional counselor can help you to reduce stress and strengthen your relationship, such as a sex therapist that can help you to reduce stress and strengthen. Treating vaginal dryness with moisturizers and improving painful sex with utilization of lubricants or vaginal dilators. There is pelvic floor physical therapy that can significantly decrease discomfort associated with involuntary tightening of pelvic floor muscles. This is a physical therapist who performs this type of physical therapy that are specially trained in pelvic manipulation and rehabilitation. And you can obtain a referral for a female sexual health or fertility preservation clinic, and we do have one here at Miami Cancer Institute. You do need a referral for that. Cognitive impairment, this is what we call chemo brain, and the treatments for this, we recommend doing some type of computerized cognitive training. The more days you do it, the better improvement. Doing that daily on a 20 to 30 minutes for 3 months can improve your cognitive brain. And this is Brain HQ. It's one of the applications that we recommend for exercising of the brain. But there are many other types of memory brain exercises that you can get on your phone, computer, or your tablet. Memory aids, use checklists or use your smartphone as reminders to help you with your memory. You want to organize your workspace and establish daily routines because that helps with remembering. You want to practice good sleep hygiene, okay? And you want to minimize alcohol intake because that affects sleep hygiene. You want to strive to exercise 150 minutes every week. That you can break it down into 30 minutes of brisk walking 5 times a week. The higher the exercise, the better improvement in your cognitive dysfunction. Okay. There are some neurocognitive labs that can be done to assess for deficiencies. Deficiencies in B12, folate, thyroid disorder, homocysteine. You want to assess for anemia, kidney and liver function. And there are some neurocognitive testing that are prescribed. You need a referral. This is done by the psychiatry department. And these are testing that is done to assess of cognitive deficits related to treatments. Anxiety treatment recommendations. You can get a referral to the psychosocial treatment with a psychologist or a psychiatrist. Uh, just to let you know, the difference between a psychologist and a psychiatrist is psychologist provides cognitive behavioral therapy, does not prescribe, and a psychiatrist can prescribe and provide cognitive behavioral therapy. And when you go through cognitive behavioral therapy, something that the provider does is to assess what are the triggers that are causing the anxiety or the depression, and how severe are these triggers, and from there they can recommend the treatment depending on these factors. There are medications that are used to treat anxiety: antidepressants, anti-anxiolytics, or benzodiazepines. Complementary and alternative treatments will be your exercise, especially the aerobic exercise. Aerobic is the exercises when you raise your heart rate. So that would be your bicycling, your treadmill, your spinning. Any type of exercise that raises the heart rate is considered aerobic, okay? And they reduce anxiety. Cognitive, you can do meditation, deep breathing exercises, and there are many applications on your phone, Apple phones, that you can access that can help you with meditation and deep breathing exercises. And I'll show you some at the end. Spiritual activities, if you're a believer, faith, prayer, and belonging to a religious support group are very beneficial for anxiety. Fatigue. Fatigue is a common problem in cancer patients, both among those undergoing active cancer treatment and cancer survivors who have completed treatments. The provider wants to assess for reversible causes. We want to make sure that there's no anemia. Metabolic or endocrine disorders will be your diabetes, your thyroid disorders, your metabolic syndrome, any pain or sleeping disorders that could be contributing to the fatigue. Non-pharmacological interventions for fatigue. Number one is your exercise. Moderate aerobic exercise or going through a walking program can be very beneficial and helpful at reducing fatigue. There are many mind and body practices. These are forms of cognitive behavior intervention, such as hypnosis, that can help with reduction of fatigue. Meditation and mindfulness-based approaches are helpful. Yoga is a very good exercise. Breathing and relaxation techniques, acupuncture, pharmacologic management is used to treat fatigue. So here we have a chart with the screening recommendations for new primary cancers. As you can see, we go to what, why, where, and when. So what, for the example, clinical breast exam, labs and imaging, and surveillance for cancer recurrence. Okay, this is what the medical oncologists and survivorship providers will give you a chart with the recommendations. The first one, every 1 to 2 years, you're going to be being surveillance every 3 to 6. And then after year 3 and 5, every 4 to 6. And after 5 years, on an annual basis. We discussed about the clinical breast exam, any imagings that are required. And then at the end, we tell you when you should be having those. The follow-up visits to survivorship. We address evaluation of depression and how often it should be done. And we provide with nutrition, depending on your body mass index. We discuss about anxiety and fear and surveillancing for that. And we go over colonoscopy, when you should have it depending on your age and when was your last one. Pap smear, also depending on your age and when was your last one. And we give you general health care as to preventive care, so that you can have all the information that you need for screening. Risk factors associated with cancer recurrence, ensuring survival. Medical comorbidities and lifestyle behaviors. So obesity is considered a body mass index greater than 25. Sedentary lifestyle, high fat diet, major depression, Alcohol and smoking are risk factors associated with cancer recurrence. Survivorship care targets these risk factors to mitigate cancer recurrence and prolong life. Care for healthy living recommendations. The American Cancer Society recommendations for individual is to keep your weight within the healthy range and avoid gaining weight. Okay? The recommendation is to be physically active, get 150 to 300 minutes of moderate intense activity, or it could be 75 to 150 minutes of vigorous intensity activity each week. You can do a combination of these. Getting to or exceeding the upper limits, that would be your 1 hour a day for 5 days, is where you get the most benefit in decreasing symptoms. You want to limit sedentary behaviors such as sitting for long periods of time, lying down, watching TV, and other forms of screen-based entertainment, because those promote sedentary lifestyle. These are aerobic type of exercise. So we have running is very good for raising the heart rate and lowering fatigue and a lot of the late symptoms that survivorships have. Spinning is also a type of aerobic. Here we have with weights. With weights, you increase your body mass, which is good for bone health, and it also tones muscles. If you're flabby, it is very good for toning. And yoga increases flexibility, increases expansion of the lungs. So these are some exercises that are recommended. Some types, but they're not limited to this. Okay, care for healthy living recommendations continued. Again, this is to be physically active. The recommendation is 150 to 300 minutes of moderate intensity or 75 to 150 minutes of vigorous intensity activity. And here in this chart, you would see what's considered moderate and what's considered vigorous intensity, okay? And there's different types of sports and home activities that are considered either moderate or vigorous activity. Nutritious recommendations in the cancer patient. You want to follow a healthy eating pattern, okay? You want to eat foods that are high in nutrients with amounts that help you to get to and stay at a healthy body weight. You want to eat a variety of vegetables, especially the dark greens, red and orange, fiber-rich legumes, and others. Fruits, especially whole fruits in a variety of colors, are beneficial. Whole grain, a healthy eating pattern limits or does not include red or processed meat, sugar-sweetened beverages, or highly processed foods and refined grain products. And it is best not to drink alcohol. And here's an example of what you can see. The bright colors are very beneficial and healthy. Alcohol and cancer. So it is best not to drink. However, if you choose to drink alcohol, should have no more than 1 drink per day for women or 2 drinks per day for men. Alcohol is the third most important preventable risk factor for cancer after tobacco use and excess body weight. So a drink of alcohol is defined, it could be 12 ounces of beer, 5 ounces of wine, 1.5 ounces of the hard liquor. In terms of cancer risk, it is the amount of alcohol consumed that is important, not the type of alcohol drink. These daily limits do not mean you can drink larger amounts or fewer days of the week, since this can lead to health, social, and other problems. Alcohol is a known cause for cancers of the mouth, the throat, voice box, esophagus, liver, colon, and rectum, as well as breast. And alcohol may increase the risk of cancer of the stomach. Also, alcohol interacts with tobacco use, increase the risk of cancer, again, of the mentioned cancers. And some research has shown that consuming any amount of alcohol increases risk of some types of cancers, most notably breast cancer. Sleep hygiene is very important, the quality of the sleep. And why is sleep important? Because sleep helps you learn information and form memories. As you sleep, the brain processes and stores information, and experiences from when you were awake. So that improves your memory. It can help lower your risk of getting sick or help you get better faster if you are sick. It also helps adults build muscle and repair cells and tissue in the body. Not getting enough sleep can have negative effects, and these include feeling more irritable, anxious, or depressed. Relationship problems, especially for children and teens, and it can increase risk of high blood pressure, heart disease, stroke, kidney disease, obesity, and type 2 diabetes. How much sleep do I need? Remember, the quality of sleep is just as important as the number of hours. So for an adult, it's recommended 7 to 9 hours. For an older adult, which it would be considered over 65 and older, 7 to 8 hours a day is what is recommended. And remember, the quality of sleep is very important. Sleep hygiene importance, the tips for healthy sleeping. So here to the left, you will see, try not to eat a heavy meal before going to sleep, drinking alcohol, drinking lots of coffee. Coffee stays in the body for 8 hours after you consume it, so it affects. So if you're going to drink coffee, try to drink it first thing in the morning and try to avoid drinking past 3 p.m. because that will affect your sleep. If you're able to stop the coffee in the morning and that's the only one, that is ideal. Try not to be using computers, tablets, phones, watching TV. The news affect and it stays in your brain, so it's not helpful for sleep. You want to develop a routine of sleep. Okay, go to sleep at the same time every night. You want to make sure that the room is very comfortable and cool enough and get a restful sleep. Okay, and try to develop this routine, and it's going to improve in your sleep, which will improve in your immunity and your well-being. How can I get better sleep? Having a sleep hygiene means that you go to bed and get up at the same time every day. So consistency and routine. Have coffee, tea, and other drinks or foods with caffeine only in the morning. Avoid eating close to bedtime. Try not to eat a large meal before you go to bed. That affects sleep. It is better to eat a healthy and filling but not too heavy meal in the early evening. And try to avoid late night snacking. Avoid alcohol in the afternoon, evening, and bedtime. Avoid smoking, especially in the evening, because it affects your sleeping patterns. Keep your room dark, cool, quiet, and free of reminders of work and other things that cause your stress. Try to solve problems before you go to bed, because it stays in your brain and it affects your sleep. Get plenty of physical activity, but not right before bedtime. Exercise 4 to 6 hours before bedtime has the best impact on sleep. Avoid looking at phones or reading devices, ebooks that give off light before bed. This can make it harder to fall asleep. There is not good evidence that wearing special blue light filtering glasses work to improve sleep. Keep the place where you sleep quiet and dark. If needed, you can use a white noise machine or earplugs to block out sounds. Blackout curtains or eye masks can help you block out the light. Do not check the time. Do not check the
Okay, let's
time at
go.
night. Try to keep
Can you
alarm
go
clocks,
there?
Yeah,
watches,
I
or
want to go.
smartphones out
Let's
of the
go.
line of sight.
What are you doing now?
Checking the time
Just
in the middle
setting
of the
this
night
up,
can
this
make you feel more
computer.
awake
You know what I
and
mean?
make it
I
harder
Setting.
wanted
for you
for
to fall asleep.
FPL to come here and to
Avoid long
cut this
naps
tree
if
so
you
I
have
don't have to
trouble
do it all
sleeping
by
at night,
myself.
especially
And
in the
in
late
adjacent
afternoon. You want to take
house, I
short naps,
wanted
like
them to
20
come
minute
here,
naps
but
that
they
can be
said that
helpful,
you have to call
especially if
FPL.
your work
Okay.
schedule
So you want me to
changes
call
day to
FPL?
day and you
No, I
need to
want to
be
call from the
alert at
computer and
different
comply with
times.
this Google, so
So
I want
these
to
are some
record it.
Do
recommended
you know what the number
books,
of FPL number is?
reading,
Yes,
and workbooks
Let's
that
see.
you can
Aurich,
access
800
for the
Aurich.
Okay.
survivor. And on the
Okay.
right side, these are
Okay. When are we gonna
smartphone
clean the
applications that
front
can
After we
yard?
help
finish
with
with them, I just want to
meditation,
leave them a message
prayer,
since they
sleep
are here and the
Oh.
stories
good stuff they
that
took
are
one
very
leave
useful
and they
to
went
help
to
you
the
sleep.
next
You
apartment.
have
Okay.
Calm is one
What
of
they
my
Come.
say?
favorite
They
ones
did
for
you say that
meditation
they were
and
here? They said they were gonna come
sleep
back.
stories,
Yes,
Insight
they said
Timer,
mañana and they didn't
Headspace,
come
but
and
there's
they
many
didn't
others
and
No,
in
but
left.
did you
the
tell them now that
Apple
they?
Yeah,
Store.
they say
Here's
not
some
to call
recommended
FPL.
Oh,
books
okay.
that
Okay.
you can
Okay.
access if you like for um, reading, for those who love to read. And in here on the right side is Spanish books for those Spanish speakers. There are some services that we provide here at Miami Cancer Institute that are very beneficial, and they are acupuncture is very beneficial for pain management, fatigue, anxiety, depression. We do have an expert, Dr. Mo, who is very good with acupuncture, and that's available here at Miami Cancer Institute. Massage therapy. This helps with stiffness of your necks, your shoulders, for general well-being. Okay, and we provide those services, and our masseuses are oncology certified, so they know how to manage patients with cancer.
I'm finishing up my Zoom to get the Zoom working.
So in summary, healthy living recommendations. Okay, cancer treatment may cause persistent and late effects. Diet, exercise, sleep hygiene, stress management are important to our immunity system, and these affect your cellular function and improve quality of life for cancer survivors. Awareness of prevention, identifying modifiable risk factors such as smoking, alcohol, and obesity are beneficial for your well-being. And of course, early detection, surveillancing, and screening is imperative for optimal quality of life. Here at Survivorship, we're here to help you, guide you through your journey, and all of the mentioned. These are some references that you can access for more information on some of the topics that we discussed. And any questions?
Recording stopped.
Thank you very much, Marie, for this informative presentation. We did receive some questions while you were presenting. One attendee is asking if avocado oil is a tropical oil. I believe when you were talking about the nutrition.
Is avocado oil a tropical oil? I do not know, but I can definitely get back to you, get the information and get back to you with that. So if you can get me the email of the person, I will get back to you with an answer.
Absolutely, I can go ahead and share that. And then another attendee is asking if you have any recommendations with cramping in the hands, legs, and toes, specifically during the evening in bed. And this attendee did specify that they are taking anastrozole.
So for the cramping, you want to make sure that you're well hydrated, because sometimes it's related to electrolyte, loss of electrolyte. Like if you're dehydrated, you're losing electrolytes, and that can trigger cramping. There are some natural products. Glucosamine chondroitin is an over-the-counter product that can be utilized for cramping or pain of the hands or legs. But making sure your sugar level is within normal range, and hydration and healthy eating are helpful for these as well.
Thank you very much. Another attendee also mentioned that they have cramping as well, and that they drink a lot of water, and specifically get those crampings during exercise. Are there any recommendations for that?
Well, you want to assess, make sure that your labs, your well-being labs are within normal range. You want to assess what could be other reasons for the cramping. Like I said, checking on your blood sugar levels, checking on your thyroid, okay? Also checking if you are deficient in some vitamins, B12, folate, homocysteine. You want to make sure that your kidney, liver function are within normal range. So I recommend that you follow up with your primary care physician and get a wellness exam, and make sure that you get some lab work that assesses for your hydration, like kidney function. Make sure that you don't have any deficiencies, and that all your chemistries are normal. And if you can do that with your primary care physician.
Thank you very much, Marie. Another participant is asking if there are any statistics on DCIS spread after total mastectomy.
Okay, so that would be a question for the expert, and that would be your medical oncologist. So I refer you back to your expert, which will be your medical oncologist.
Thank you very much, Marie. And an attendee is asking if you could go back to the slide where you have the books and applications on the phone. To this attendee, I will also be sharing a screenshot of these books and apps, as well in the thank you email that will be sent on later after today's program, so you will have a copy of that.
Yes, they can take a picture of it, and these are excellent books and apps for relaxation, meditation, and sleep.
Thank you very much, Marie. We have an attendee asking if any of these services are available at the Plantation campus. They mentioned that the Plantation campus seems to have limited offerings there.
Correct. I'm not aware of all of the services that Plantation have. However, I can find out what are the services and get back with what they offer over there. But do know we do have massage therapy, nutrition, acupuncture, physical medicine, psychology, psychiatry here at Miami Cancer Institute, as well as a new mindfulness class that is being offered for free, which is an hour of a provider walking the patient through deep breathing exercises, guided imagery through visuals, and she walks the patients to a calm state that they can incorporate in their home. So that is one service that is available here at Miami Cancer Institute that survivors can utilize.
Thank you very much, Marie. Another attendee is asking, how can I address my insomnia after I've completed my cancer treatment?
So if you're a survivor at Miami Cancer Institute, there is a psychiatrist that her specialty is in sleep disorders that you would, need a referral to the psychiatrist for sleep disorder evaluation and management, something that can be very helpful with walking you through as to causes of the sleep disorder and how to manage it. And that is something available here at Miami Cancer Institute.
Thank you very much, Marie. Another question we have is, does it matter how far in survivorship to be eligible for these benefits?
Well, usually it's less than 5 years. However, if you're having symptoms and you're one of our patients, you can always reach out to survivorship and we will make sure that you get the services that you need.
Thank you very much, Marie. A participant is also asking on any vitamin recommendations. I believe in regarding to the section where you focused on nutrition.
Vitamin recommendation, it all depends on many factors. It depends on, are there any vitamin deficiencies? Are there any symptoms? Because we can help, like for example, peripheral neuropathy, the B complex supplements, vitamins are very helpful. So it all depends on what are the symptoms, are there any deficiencies, and we need to make sure that the provider does a physical exam to assess any other symptom that the patient may have. So it depends on those factors. A multivitamin a day is beneficial, but you want to make sure that we assess other things, other symptoms, deficiencies, make sure are there any other issues going on, like obesity, comorbidities, high blood pressure, and things like that.
Thank you very much, Marie. An attendee is asking if you can please repeat the vitamin mentioned for neuropathy.
Sure. Let me go back for neuropathy. And you can have it done with your annual wellness exam. I'm going back to the peripheral neuropathy. go.
Thank you, Marie.
So with peripheral neuropathy, you want to assess for B12 levels, homocysteine, ferritin, thyroid is important. And you want to make sure that you're getting your hemoglobin and hematocrit checked. So those are the most common deficiencies that we see with peripheral neuropathy.
Thank you very much, Marie. We did receive a question regarding everything, all the information discussed during today's presentation. And to all of our attendees, we will be sending out a thank you email after today's program, and it will contain the screenshots to the book recommendations and applications as well. If you would like to access the recording to this program, please reply to that email that I will be sending this afternoon. And with that, I do not see any more questions in the Q&A box, so we will go ahead and close out this program for today. Thank you, Marie, for this incredible presentation on survivorship, especially after breast cancer, and thank you to all of our attendees who tuned in. Like I mentioned earlier, we will be sending out a thank you email. In that thank you email, please let